Yemen's ongoing war between the Houthi rebels in the north and the Saudi-backed Yemeni forces has had an adverse impact on the country's overall healthcare system. But now, with the Houthi rebels suspending flights in and out of Sanaa, the humanitarian aid and imports have significantly declined, which has had a catastrophic effect on an already decayed health system. Now, all of this at a time of a pandemic. Take a look at this report.
In the Yemeni capital, Sanaa, Mohammed Al-Ghazali's kidney dialysis machine often cuts out during the day. When the electricity generator runs out of diesel, nurse Mohammed Al-Hatami turns the blood filtering machines by hand to prevent clots.
As soon as I get there, I face a bigger problem. The dialysis machine cuts off during my dialysis and they say the machine has stopped. Why? Because there's no electricity.
The other problem is when the generator cuts off. The machines cut off and we are forced to move the bloodstream manually to stop the blood from clotting. And we try to do our best. We are calling on all relevant authorities to move on this front to try to save the people.
Electricity shortage is a huge problem in Sanaa. Northern Yemen, which is controlled by the Iran-aligned Houthi movement since it ousted the Saudi-backed government from power in late 2014, has suffered fuel shortages throughout a 5-year war. That in turn has shattered Yemen's healthcare system.
ICRC does have a number of projects related to supporting with the power in specific hospitals and has done over the past years, but we don't systematically support with fuel because it is beyond our capacity, except the occasional emergency response to this.
Imports of fuel needed for generators, water pumps and transporting goods have dropped sharply in the past 3 months. Imports into Houthi-held areas have to go through stringent controls imposed by a Saudi-led military coalition battling the group. 2 weeks ago, the Houthis suspended UN and humanitarian flights to Sanaa in an apparent act of protest, impacting aid provisions. The ongoing coronavirus pandemic has deepened a humanitarian crisis that has left 80% of Yemen's population reliant on aid.
We need to enhance the offer of medical services for being able to cope with this disease. So the center will be a facility that will be able to treat patients that currently have very few options, if any, to obtain adequate medical treatment.
Ahead of a possible second wave of the virus, the International Committee of the Red Cross this week opened a free 60-bed COVID-19 clinic in the southern port city of Aden, the Yemeni government's temporary capital.
We're trying to support the moderate cases, trying to get cases early, particularly, as we mentioned, the center in Aden, because there's a lot of stigma and fear around COVID. People don't want to come. So we want to really encourage people to come, because if you get oxygen treatment, for example, early, this can also make a very big difference. So there's so many factors. There's a lack of testing, lack of data generally, and we don't, honestly, we're not at the forefront of understanding or mapping or predicting really what will happen in Yemen.
Testing and reporting of coronavirus cases in Yemen is low, and United Nations says the virus is circulating undetected. Moreover, Houthi authorities have not provided COVID-19 figures since May 16th, when they reported 4 cases and 1 death due to the virus. The Yemeni government authorities, on the other hand, have declared over 2,000 cases, including 586 deaths. Is that the real impact of the virus, or is the war-torn country headed for a bigger health crisis? The truth is, we may never find out. Bureau Report, WION. Bureau Report, WION. World is one.